Hello, and welcome again to another episode of Cutting Edge Health, where we look to explain to you options and help you understand how to be able to get your life back and be able to lead one that's free from pain and free from suffering, be it physical or emotional. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician who helps patients be able to have understandings about what are different conditions that worsen both physical pain as well as mental and mood as well. So today we're talking about why winter worsens mood and pain. So as we know, recently we've had these cold weather breaks that have kind of broken out over the aspects of the country where snow is pretty prominent and present throughout, and it's really getting after it. So there are warnings and blizzard warnings, particularly here in the Midwest, that have really looked at winter pretty significantly. So winter itself, as defined, is the coldest season of the year, as we very well know, and is characteristic of the season. There's a whole host of different etymologies of the word and kind of Germanic components. But at the end of the day, we know that there's frequently a fair amount of depression that's associated with winter, right? So we're going to look at three different papers, and those three papers are going to be the following. One that looks at seasonal affective disorders, common questions. A second one, which is going to be a paper that looks at subjects with knee osteoarthritis with widespread hyperalgesia. And then the third, where we really kind of tie in a really fancy topic that we're going to explain why I'm talking about this, that is basically pain-related behavior associated with increased joint innervation, ipsilateral dorsal horn gliosis, and dorsal root ganglion activating transcription factor 3, expression in a rat ankle joint model of osteoarthritis, right? So fancy, fancy, fancy. That just seems like it has no pertinence. But stay with me. We're going to definitely explain it so you get it. Okay, so let's start back from the beginning, right? So let's start with kind of seasonal affective disorder. What exactly does that mean? How is it potentially impactful? And where do we go from there? So seasonal affective disorder, or here this acronym for SAD, it's similar to depression, and that you can have depressed mood, you can have lack of energy, you can have the loss of ability to feel pleasure or interest, right? Typically, it's a little bit different than some other forms of depression, but it can also have changes with increased sleep duration, increased appetite, as well as weight gain and altered eating habits, particularly with a craving for carbohydrates. So, truthfully, it's traditionally classified, if you were to ask a psychiatrist, as a mood disorder. And it's typically a blend of the major depressive disorder or bipolar disorder, which is specifically stated as depressive symptoms that can occur at a specific time of year, right? And we kind of know that time of year. We know it's that area of winter where it's just really just frigid and we're just feeling it. So let's talk about what are some of the indications and risk factors and things that kind of sit along those lines. So traditionally, the risk factors include family history. So it's other people have that. Sometimes gender, living at a more northern latitude, ages from 18 to 30. And if you have other things like mood episodes, the diagnosis requires full remission in order to be able to identify. All right. So how frequently is it present within the population? It basically says about 5% of the US population experiences seasonal affective disorder, with some symptoms present for about 40% of the year. Actually, there's another reference that goes to a different amount, which says that the ranges can be anywhere from 1.4 to 9.7% in North America. So in essence, you could say almost 10% of people have some degree of depression that's associated with winter, as we kind of expect, right? So what are some of the things that we can do about it? Well, you can consider doing light therapy. You can consider doing pharmacotherapy. You can consider doing cognitive behavior therapy as potential options. And we're going to explain the details of all of the above, right? So the first line therapy for seasonal affective disorder is light therapy, antidepressants, and cognitive behavioral therapy, either separately or in combination. So there are different devices out there, which we'll review in a video at a later time, that administer light therapy or similar to dawn stimulation. And traditionally, it's 2,500 to anywhere from 10,000 lux for about 30 to 60 minutes at the same time every day can be useful. If you get into the details of that, the way to be able to kind of diagnose elements of seasonal affective disorder is that stated before, it fits under the depressive disorder characterizations or bipolar. It is traditionally recurrent at a particular time of the year, traditionally winter. Psychological stressors can be associated with this episode that do not qualify for seasonal pattern or specifier. Um, there's relationships sometimes between a number of different episodes occurring. And when we take a look at the one paper, it talks about light therapy being pretty darn effective. If traditionally A is consistent and B is a ranking that is of somewhat decent quality, it's comparable to sometimes using antidepressants like selective serotonin reuptake inhibitors or SSRIs, as well as cognitive behavioral therapy. So we've kind of expressed the aspect of being depressed during winter. Certainly, there's quite a bit of literature behind it to be able to support it. But how about the adage of when it's cold outside, I just can feel it in my bones, it just aches. So we talk about this areas of arthritis, like we can see in this hip, and knowing that osteoarthritis is basically this change that takes place in the joint through wear and tear that results in different cartilage fragments that are present in the fluid, specifically the synovial fluid. And so when we take a look, there's a paper that looked at osteoarthritis, particularly in relationship to cold. And we know that it's pretty prominent as a whole, but normally I think we believed that it was isolated to just the joint. And there's actually some thought process that it may be bigger than that. So what this paper did was to take a look at ways to assess how can one have aspects of hyperalgesia with cold weather. So what does that mean in English? And in terms of explaining it, hyperalgesia is basically the elements of you having pain that's out of proportion to what you normally would experience. So, for instance, let's say that you had your hand and you had a little flick, and you would think, oh, well, no big deal. But when you have hyperalgesia, that flick is much harder. So, saying hyperalgesia again, you got to kind of say it with a little bit more prominence. Hyperalgesia, the pain is more prominent than what you otherwise would expect, right? So, talking about this paper itself looked at the following. It basically had patients that had similar age, gender, height, and BMI, although in this particular paper, the BMI, meaning body mass index, was greater than what you would normally expect. And it assessed the aspect of back pain, particularly when they were placed in a temperature controlled lab at 24 degrees Celsius. And what they found, we can see graphically represented across the knee, the ankle, the elbow, and aspects of the back, is that the osteoarthritic component, which is the people that had arthritis, and versus people who didn't have arthritis, they saw that they had an increase in pain compared to others. So there was a notable statistical significance for multiple different areas. What the paper actually ends up postulating is something that's really interesting. And I think something that's really useful for understanding how to be able to deal with arthritis, maybe a little bit different than normal. And this is kind of a tidbit. So for those of you who are first watching, I'd kind of tune in and maybe like go back and forth on hearing this. Normally, when we think about joint pain, we think about treating it with maybe NSAIDs like aspirin, ibuprofen, or kind of natural NSAID type elements, or trying to see if we can do things like bracing, or maybe if you thought significantly things like surgery, right? Well, this paper actually poses some other things. It states that potentially there's a central driver of hyperalgesia. So what is a central driver? So a central driver being that maybe it's not just the joint alone, but that joint has influences on the spinal cord and how that spinal cord communicates with the rest of the nerves. And because of that, these nerves can cause an increased pain sensitivity greater than what we might otherwise think. So I think that's a kind of revolutionary thought process because we normally would just think, if you have cold and you have a joint and it hurts, is because you have arthritis in the joint. Like the one picture that I showed you before, you got a problem with the joint. It has issues and has anatomical deficiencies that would cause you to have that problem. But this actually suggests that not only is it that at the site, but it's present throughout the body because of how that sensitization peripherally has now affected the central nervous system to cause further pain. Meaning, in simple terms, that not only is it the joint, but the nerves that go to the joint that talk to the spinal cord, they are impaired and can make the pain feel worse. And that's the reason why we're talking about that other paper that is all about basic science in rats and such. So, anyway, finishing this up, what they basically state is that you could definitely see that knee osteoarthritis was worsened with the presence of cold. But that presence of cold resulted in pain that was present not just at that joint, but broader than that. And it's not that uncommon with a lot of different musculoskeletal uh, problems that present. And so the final line is knee osteoarthritis can no longer be seen as purely peripheral pain disorder in all patients. And now this does not mean that someone has osteoarthritis that means that they automatically have a nerve problem that goes throughout their body. It's not the case. But is it a possibility? Yes. So that's what this research paper that was shown previously kind of goes into. So it's a lot of words. It looks super fancy. I know it seems scary, but again, as I've said before, definitely going to explain it so that you can be able to get it and that you can understand it and that it's not going to be something that's going to be outside the realms of being able to kind of get this. Okay. All right. So let's explain what this paper is looking at. So what this paper is looking at is it's looking at a portion of the spinal cord, right? It's one of the reasons why we're using this basic animal model. So it's looking at the spinal cord, and in essence, what it's trying to do is to be able to take the areas of the cord and look specifically at this area right here at underneath 13, which is the dorsal root horn or dorsal root ganglia. That area comes from the spinal cord and is like a little mini brain at that segment of the cord. So if you are looking at a model like this and you took a look, you can see as you take a look here, they have these little bubbles, which are representative of these dorsal root ganglia. And these dorsal root ganglia here, they have their own communicative fashion with the rest of the body and have much more input than what we originally thought. We used to think that they just kind of just got a signal in, sent the signal out. But they can modulate signals, they can decrease signals, they can increase signals. And in essence, there are different treatments now that focus on the DRG specifically to be able to decrease pain even more aggressively than you otherwise would be able to. So this paper postulated that osteoarthritis is poorly managed and that we know that there's a neuropathic component that's present in osteoarthritis. So what they did is they basically overlaid an osteoarthritic problems, an ankle joint in the presence of this aspect of the rats, and they did various different things, and they evaluated what happened to the joint, that DRG that I mentioned before, dorsal root ganglia, and the spinal cord, in order to be able to get some understanding about are there things that can be done. And the quick summary, without taking you through all the different kind of like pictures and slides and everything else, is that what they found is that the sympathetic nervous system and that DRG is involved in pain. And there's a specific element that's called a transcription factor 3 that's present in DRG that shows evidence when you have neuropathic pain and osteoarthritis. So let me explain that a little bit more clearly. In essence, like I said before, from the other paper, when we looked at when you have a knee problem and you have this widespread pain that's present throughout with the nerves, does everyone have that? No. But those individuals that have that specific transcription factor, at least within the basic model that was looked at, was seen to most likely have a nerve problem that's associated with it. And the thought process is in the future, maybe that's a way that can be identified to be able to help see, is it just a joint problem or is it a joint in combination? So this animal model looked at kind of that peripheral nerve, and they were able to see that there were changes that were associated, as I just stated, with this activating transcription factor 3 expression in that little bump or little hump, as they showed in both the model and the others, right? So at the end of the day, they were able to see that osteoarthritis is this spectrum. And it's a spectrum of things that start from the areas of this joint damage to degradation of cartilage to then being very important, if it's not dealt with soon enough, a sensory and sympathetic fiber innervation to the joint change, which then can impact the dorsal root ganglion, the dorsal horn, and you can see that there's sometimes this expression of that transcription factor that's present in the DRG. So, what does that mean in terms of thought process for treatment? Well, there may be ways that when you use different treatments like regenerative medicine treatment, you might be able to halt that nerve problem from occurring. So while we're using different treatments like NSAIDs to make it not feel so bad, or pain medicines like an opioid, we may be making that feel better, but we might not be stopping the progression of that nerve sensitization, which then causes more problems and potentially more pain. So when we look at the aspects of this in its totality, right? The summary was the data reinforced the concept that multiple factors are contributing to pain and osteoarthritis. And so that the time course is relevant to osteoarthritis, and it may need to be assessed in terms of how neuropathic pain involves all of this. So what I would say is cold weather we know has an effect on seasonal affective mood disorder, right? We know that you can have an issue with how you feel, and we've talked about it in multiple different videos before in the past, how mood definitely influences pain and vice versa. So that's one. But two is that it also influences the joints, and it's not a wives' tale. It's not a tale that's like, oh, well, this is just kind of anecdote that basically it's cold outside and so my joints hurt. No, there's reason for it, and they've shown it in both traditional and human models as well as in animal models. And now we're seeing that maybe that pain that's present in the joint doesn't just stick with just cartilage loss alone, but there may be other nerve problems and issues that are associated with it. I appreciate you guys joining us and being able to kind of take a look at this topic of why winter can worsen mood and pain. We look to continue to be able to provide different options for you to understand what's going on with your body, how to be able to improve different problems and issues, and how to be able to punch pain in the face and get back to leading the life that you deserve. Thank you so much and have a great day.